we saw that cat increase libido but lowers performance. So some will take cannabis to ensure that there is improvement in terms of performance. Some will take alcohol to increase multiple effects. Next, effects on individual, quite a number of effects. The leading one is time wasting. There's economic and financial deterioration, like what has been said by Nakada. I'll give you a survey that was done by Nakada on how people diverting their resources and their time and their energy to this stimulant. Social isolation, loss of job, a gateway to other hard drugs, poor academic performance, and school dropouts. In terms of effects to the society, it has led to a lot of family breakdown, income diversion from school fees to cut, from house rent to cut, increased psychiatric illnesses, increased crime, increased unemployment. It is also a precursor to GBV, gender-based violence, and increased road traffic accident. Next. Some of the effects, like I talked about the oral cavity, you are seeing how cat has destroyed the dental formula of this guy with a lot of tooth mortality, quite a number 1 or 2 tooth mortality and tooth decay. In terms of behavior, there's a lot of aggressive behavior, anger, aggression, and irritability immediately after use, and if somebody is experiencing withdrawals. Next, like I said, in terms of social prevalence, documented by a survey in Nakada, it shows about 17% of Mira chewers, both Moguka and Mira, failed to go to their workplaces because of taking Mira. Approximately 22% of the respondents had used money meant to do other household things like buying food, pay for school fees, to buy Mira and Moguka. It was also noted that those who introduced people to chewing cats, the leading one was friends, followed by relatives, then parents, and schoolmates being the least. Like I said earlier, cat chewing reinforces the development of cigarette and alcohol intake, reinforces the use of polydrug use. As I'm winding up, it is good to note that this is a Daily Mirror, a European magazine that was gazetted in 2013, January 2013, which really indicated and showed that there is this crop that is coming from Kenya that the Europe does not want. Why does Europe do not want this plant? It is because it is linked to a lot of many road traffic accidents. So, in terms of winding up in recommendation, key things that we need to note is it is evident from the facts here that Mura and Muguka contain caffeine and cathinone, which is controlled substance, which is a stimulant, amphetamine-like, that need to be, it causes harm in health. So there is need for regular sensitization to the public on the effects of Muguka and Mira. There is need for primary prevention at schools and learning institutions. There is need to embrace good and religious parenthood for all. Religious leaders and other opinion leaders need to sensitize and have a clear-cut message to the people who they lead. And lastly, we need to do advocacy to the county, to the national government, to have it be in the correct position of narcotic and psychotropic substance, as outlined by that Act of 1994, which says caffeine and cathinone are controlled drugs. So with this, thank you so much. I'll welcome 1 or 2 questions through the moderator. Thank you.
Thank you, Mwakazi, and thank you so much. And I believe each and everyone has heard about the recommendations, and I believe that change starts with empowering individuals so that they can make informed decisions. And from the recommendations, I can see there are cue to actions that individuals who are consuming Muguka should take up. And at the end of the day, we would wait and see if at all they will change their behaviors. So the floor is open. As I had earlier said, that at the end of the session, we will have a dedicated question and answer session. So the floor is open. Anyone with a question is free to ask. So just raise up your hand and you'll be given a chance to ask a question. Thank you. Any questions? We can also type the questions on the chat box, and then I will be able to read them out for